Hi and welcome back. In this lecture, we're going to talk about Key Insight 1, Healthcare Equity and Distribution of Healthcare Related Resources. Well, the healthcare industry is estimated to be about 11.9 trillion US dollar industry in the year 2022 and will continue to grow. So there are quite a number of factors like growing population or in some countries an aging population and also an increasing number of patients with things like long-term and chronic conditions. Then there are also other economic factors like the increasing cost of infrastructure and increased investments in medtech or healthcare technology. Then there's rising labor costs and staff shortages as well as a growing demand for a broader healthcare ecosystem which is forcing the healthcare industry to change course. So if you look at this whole COVID-19 pandemic, it put a tremendous amount of pressure on the healthcare industry, and in some countries the healthcare system collapsed as well, resulting in the loss of thousands of lives. So what made these systems collapse, and can we avoid that kind of collapse in the future? So even if some pandemic comes or even a bioweapon is distributed all around the world, accidentally or intentionally, is the healthcare system able to cope up with some kind of threat like that? Then there are other trends like establishing and expanding universal healthcare systems. So when we look at the COVID-19 pandemic, it opened our eyes to a lot of issues in the healthcare industry. One such issue is the inequalities in the healthcare industry. Especially if you look at things like the vaccine distribution, there were lots of countries who haven't even administered the first dose to more than 25% of their population, while the richer and the more developed countries were administering their fourth dose. And also the people who passed away, a lot of them were from minority communities with little access to healthcare. So now we are seeing the whole trend of coming up with a much more dynamic system which can cater to and achieve truly universal healthcare for everyone despite of their income status or social status. Then we are also starting to see the price control measures on pharmaceuticals and medical technology devices by different regulatory authorities rather than getting the manufacturers to come up with a price and sell it at a price that they wish to have and make a massive profit out of it. Government and other regulatory bodies are intervening in order to control the price and make it more affordable for the patients. Then another trend that we're seeing is a transition to value-based care from volume-based care. So first let's explore what volume-based care is. So volume-based care is basically also called fee-for-a-service care. So this is basically focusing on incentivizing healthcare providers for any kind of services or procedures that they have performed. So the more procedures and services that they perform, they get a higher reimbursement, meaning much more higher profits. So this usually ends up with healthcare providers requiring patients unwanted tests and treatments and other kind of diagnosis which might not be very necessary. And another major drawback of volume-based care is simply this method does not factor whether high quality treatments are given. So it does not monitor any kind of patient outcomes, whether the patient have readmissions. So for example, let's say you're admitted with cholesterol and you just give medication and continue the medication for the rest of their life rather than focusing on nutrition and improving their lifestyle choices as well as exercise routine in order to keep them healthy and active and also take more proactive steps when it comes to reducing diseases. So this type of method usually raises ethical concerns as well because you're just focusing on the volume of care. Then we come to value-based care. So this method focuses on the outcomes and not the number of services or procedures rendered by a healthcare provider. So this is much more difficult and complex to achieve because you need much more tighter integration between different parties in the healthcare industry, whether it's suppliers, specialists, doctors, physicians, dentists, all these sorts of providers, primary care professionals. So all these professionals must work hand in hand to ensure that value-based care is achieved. And also, each physician might have to spend more time on each patient because every plan must be customized. Of course, we can use digital tools like artificial intelligence and other kind of innovative technologies, but the usual transition might be a bit challenging for the healthcare professionals. And also in this method, healthcare providers are evaluated on a variety of factors. So how many readmissions, how many adverse events associated with their care, are the patients engaged, so what about the patient experience, have their desires and needs met, and also how reasonable are the services, value for money and things like that. So what are the benefits when it comes to value-based care over volume-based care? So there are significant tangible benefits when it comes to things like more customer-centric service focusing on delivering a great patient experience. Because in this value-based care, healthcare providers are encouraged to be more proactive and think about the holistic picture. So things like population health management. So the overall picture is clearly established in this value-based care. And also we have significant data-driven decision making. So we focus on driving decisions based on data. For example, let's say you have a heart problem. So something like you have high cholesterol. So not only you'll be advised by the cardiologist, you will also be advised by a nutritionist and also someone who is in charge of physical activities. So they will also look into changing your diet, discussing the dietary requirements with you, and also going into much more detail about your lifestyle, whether you're walking or exercising, or are you performing any kind of physical activity? If so, is it effective? So all these little factors will be considered to improve the overall health of the patient. So there are challenges like increasing the workload for professionals and also an increased demand for all stakeholders, because there has to be very tight levels of collaboration and coordination amongst all the providers and stakeholders in the healthcare industry. So now let's side by side compare what volume-based care and what value-based care is. So if you look at volume-based care, it's based on the quantity of services and procedures performed. On the other hand, value-based care focuses on the quality of the care, or what we call the outcomes given to the patients. Then when we look at volume-based care, it's basically doing more equals earning more regardless of the patient's outcomes. But if you look at value-based care, it's encouraging greater coordination of all the resources and stakeholders to improve both the efficiency and the quality of service delivered to the patients. Then if you look at volume-based care, there's a higher chance of patients receiving unnecessary and duplicated medication, treatments, diagnoses, and tests, whereas volume-based care will take a much more data-driven approach based on the patient outcomes. And if you look at volume-based care, there's often higher cost services and procedures are often prioritized over a much more holistic approach, while value-based care focuses on utilizing all the resources and focuses on a more holistic approach. Then let's explore what population health management is. So this is another trend that we're seeing when it comes to healthcare distribution and healthcare equity. So this is basically the process of improving the health outcomes of a group of individuals, including the distribution, aiming to improve the health of the overall human population. So it's basically understanding the metrics to really focus on how to measure the health of a certain population and also understand what are the factors which affect those metrics. So if you look at population health management, there are 6 main components. The first is care integration. So it's integrating all the healthcare providers through one single network so that everyone shares information with each other and there's no redundancies and inefficiencies within the network. And also it promotes much more better resource utilization. Then we have the second component, which is care coordination. So integrating care from a variety of providers. So let's say you want to work with the physiotherapy, you get them on board. You want to work with a general physician, you get them on board. You want to work with a cardiologist, you get them on board. So you come up with a comprehensive plan of completely restoring the health of the patient and even transforming the patient's health to a much more better level than they got the disease. So that includes things like long-term planning and also continuous observations of the patient's vitals as well as patient's physical activities as well as nutritional demands. Then we have the third component, which is basically teamwork. So removing the fragmented components of healthcare. So getting everyone board on the same page. Then we have things like patient engagement. So how engaged are the patients? What about the patient experience? Are their desires and needs met? Are they comfortable in asking the questions? Are they made aware of the choices out there? And are they empowered to make the choices that they are most comfortable taking with? So all these factors are component of patient engagement. Then we have the backbone of it, which is basically healthcare IT and data-driven analytics. So technology and data-driven healthcare IT. So technology will play a major role in terms of delivering population health management because it will help us to aggregate everything into one single source and give us trends and insights using different data visualizations like charts and graphs and tables for us to really understand how well a population is doing. This is very useful for decision makers. For example, how much of taxation are we going to do on things like smoking and alcohol? And are we promoting things like organic products? So all these factors can be taken into consideration. And finally, we have things like value-based care management. So what are the metrics that we're going to measure value-based care on? So coming up with these type of metrics is really hard because in contrast, if you look at volume-based care, it's just a matter of taking a head count of the patients, then aggregating them, the number of admissions, you can take account of that and aggregate that. But when it comes to volume-based care, how exactly are you going to measure it? What are the right tools to accurately capture it? So just because a patient gives a 5-star rating on a customer review, does it necessarily mean that the patient's needs and desires have been met? So questions and factors like this must be asked and answered. Well, that's about it for Key Insight 1, Healthcare Equity and Distribution of Healthcare Related Resources. I'll see you on another lecture.